The family of a teenager who died from a blood clot linked to her birth control pill are urging others to consider the potential risks associated with the combined pill. 19-year-old Aine Rose Hurst had been taking Femodette for 4 years before a routine health screening revealed she had high blood pressure. She was advised to stop taking the pill to allow her blood pressure to stabilise, but then started back on the same medication after getting a fresh prescription from her GP. 3 months later, she died. An inquest into Aine's death, ruling that the contraception was properly prescribed in line with UK guidelines. Suffering blood clots as a result of the pill is rare, affecting around 1 in 10,000 women, but Aine's family told me many women don't fully understand the risks involved.
When she was nearly 16, her mood swings and her periods were quite heavy. So for that reason, we went to the doctor and they suggested that she go on the combined pill at the time. So we agreed to that. And we thought it was a safe option at the time.
Yeah. Aine had been taking this particular pill, Femodette, which is one of a wide range of combined pills available to women for 4 years with absolutely no problems. And then, Dawn, she went for an annual review, because when you're on the pill, as all women will know, your GP says you have to go for checkups every year or longer if you're a little bit older.
Yeah, she went to see the nurse at the health centre.
Because it was a routine?
Her annual appointment in December of 2024. And they checked her blood pressure, as they should do in them appointments, and it read high.
Taking the pill, one of the side effects can be blood clots, the NHS saying that blood clots affect up to 1 in 1,000 people who use combined hormonal contraception like the pill. So Aine will have been told this when she was put on the pill, 4 years before, and that's what those regular checks were about. What happened when she went back to her GP following her nurse appointment, Kerry?
She went back to talk about an alternative, and the GP did her blood pressure, and her blood pressure was, he said, within guidelines. So therefore he recommended she go back on the exact same contraceptive pill. When she came home after that appointment, we was concerned and we voiced that concern with her, and she just said, well, that's what the doctor has said.
Aine died 3 months later.
Yeah.
Can you talk to me about the circumstances?
She'd been out at the weekend with her friends, had a really nice evening. The morning after, she'd stayed at her friend's, and the morning after she rang me and said, I'm coming home, I've got hangover. But when she got home, she decided she was meeting up with a boyfriend and going out for food, so I didn't think she was that bad. That was the Sunday. The Monday, she works from home on a Monday and a Tuesday. So she got up as normal, worked all day. That evening we sat together in our evening meal, but she was still complaining of a headache. So I was encouraging her to drink plenty of water, fluids, and take regular painkillers. Monday night she went to bed, and the next thing I knew, she come in my bedroom just after 5-ish, 5:15 in the morning, crying, saying that her head was really hurting, that it was getting worse. And at one point she begged me to take her to the hospital. And I ended up ringing the GP's surgery, and they told me to get her to go online and book a consultation. And I said she wasn't capable, so they said in that case you need to be ringing 111. I did that, followed that advice, and while I was on the telephone, they was asking me to ask Aine to do things. And at first she was responding. But then she just stopped responding, and her head was going back, and she started foaming at the mouth. And at that point, they told me there was an ambulance on its way. The ambulance was very quick. And they came in, 2 paramedics, and they asked could they stand on the bed, and I said do what you need to do. And they put tubes in her to help her breathing. And then they said we're going to get her to the ambulance as quickly as possible. And then they took her straight to the hospital.
An inquest later found that Aine died from a blood clot in her brain caused by a rare side effect of the combined contraceptive pill. I mean, Kira, it's so visceral you talking about that. You remember every single moment of Aine's final moments. What did the medical team say to you at the hospital? That's what the inquest found. What were you told at the hospital when you arrived with your daughter?
They said they'd taken her for a CT scan. And moments later they came back and they said that we recommend you ring family and get family here. And once family arrived, they then told us that she'd got this clot and that they would do what they can, as in try with Manchester, Salford it was, to see if they could take her there and operate, which they decided that wasn't, they couldn't, it was just too...
The blood clot was too big, wasn't it?
And where it was, where they'd have to go in, it would just probably make things worse. And they told us that if she was to survive, she probably wouldn't be the same person. And once they'd tested her brain to see if there were any function, if there wasn't any response, they would turn the machines off at that point, which they did. In the end, there wasn't any brain function. They turned the machines off. She died within minutes.
Kerry, I'm so sorry for you and your family's loss. It's unfathomable that something that so many young women take for granted, the contraceptive pill, take every day. They think they know the risks. Aine was told the risks. There's a leaflet in the contraceptive pill packet that runs to, over 100 pages long. And the NHS saying that blood clots affect up to 1 in 1,000 people. But people have this perception that it's rare. It will never happen to me. I mean, Dawn, that's just something that you want to tell people is not true. This could happen to you. You need to be aware of the symptoms and you need to factor it in as a real risk factor.
Yeah. I don't think there's a lot of awareness out there of the side effects, and like you say, in particular with Aine's pill that she was on, inside that packet, inside that box was a 102-page leaflet, which it's
Nobody reads.
Nobody reads.
Nobody reads.
I know, probably now, my God, would we have read that?
Yeah.
However, people don't, especially young girls. And there's got to be clearer labelling on these packages. Just even when people are looking to go on the pill, they need to be made aware of exactly what the side effects are and family history of blood clots and all sorts of things like that. I just feel there's so much more that can be done to prevent this tragedy ever happening again.
Kerry, your particular focus is on online purchases because, something that women celebrate is the freedom and the access to women's health
in the UK. We are privileged to have that and to have that access, but it can come at a cost. You can go on a website, a reputable pharmacy website, and buy the pill online, but it doesn't come with that structure, with those health checks, and that's something you're really concerned about, given Aine's story.
We thought we were being responsible doing it through the GP, but we've later found out that actually anybody can purchase it online or in a pharmacy without then the checks that a GP should be doing. We just want more awareness around the potential side effects and what young women are taking and putting in their bodies.
Well, a really difficult interview, but one the family really wanted to do. The Hurst family want people to remember that this can happen to anyone. The NHS saying blood clots affect up to 1 in 1,000 people. Well, after speaking to Aine's mum and aunt, we reached out to the Bolton GP Federation, who said we would like to express our sincere condolences to Miss Hurst's family at this very difficult time. In relation to the GP as his employer, we carried out our own internal review and considered this alongside the findings of the inquest. Our review and the inquest both concluded that the GP consulted with Miss Hurst in line with the UK Medical Eligibility Criteria, the nationally recognised guidance used by clinicians when a patient requests this medication. Well, let's speak now to the GP, Dr. Nikita Kanani. Nikita, a really, really upsetting interview, that, an absolutely heartbroken family there, but they were keen to stress that they don't want to be alarmist about this, but they want people to be aware of the risks. Their point was that so many young women go on the pill for so many reasons and listen to the risks, but don't really take it in.
Yeah, absolutely. Look, first of all, what a deeply sad case. It was just an utterly devastating story, both what the family have been through and continue to go through. And as you say, the family asking not for blame, but for clearer information, better awareness of side effects, and really reassurance that young women are better supported. And many women take the pill, and it is a wonderful invention in many ways, and has given women so much freedom. But like any medication, it does have side effects, and those side effects include some of the very common ones like nausea, breast tenderness, headaches, changes in bleeding patterns. But also there are rare and very serious side effects, which do include blood clots, particularly with these combined oral contraceptive pills. So the overall risk at a population level remains low, but it does vary depending on the pill and the individual. So that tailored guidance is really very important.
Yeah, the GP in this case followed the national guidelines and had the conversation with his patient, Aine. Do you think the guidelines need to be re-examined or a little tougher?
I think the guidelines are very clear, and when you put them into practice, when you're talking to your GP as a patient, you're going through the different kind of scenario that you might be in. Most women are well protected by the pill that they're on and the regime that they're on. But I think it's really important that a couple of things here. I think, first of all, when a woman is starting or reviewing the pill, they should feel able to ask which pill they're being prescribed and why, and what side effects there are, what are common, what are rare or serious risks to be aware of, which symptoms are urgent, and when they should come back for review. And it's really important that we talk about this and that women know the sorts of questions to ask, but also when to seek urgent medical help. So some of the symptoms that it's really important for listeners to know about, some of those symptoms that might be suggestive of a blood clot, for example. That includes pain or swelling in one leg, sudden chest pain or breathlessness, coughing up blood, sudden neurological symptoms as well. So in Aine's case, the severe headache, vision changes, weakness. These symptoms are uncommon, but that early assessment really does make a difference.
The family have set up the Aine Rose Contraceptive Safety Foundation, advocating for clear, honest, easy to understand contraception labelling so people can make truly informed choices. Of particular concern to Aine's mum and aunt was the rise in online pharmacies and what you can get on there. Their point being that you can go on as a young woman and get hold of the combined pill, but you're not necessarily supported by that review structure where you go for your 6-month checkup, which, you know, all women have to do. They might find it a bit of an inconvenience, but as we've learned there, it's for a very important reason.
Really
Is that something that's of a concern to you? Because, you know, again, all women want convenience and it's to be celebrated we have access to women's healthcare like this. But without the structures in place, it could potentially be dangerous.
That's right. Look, you've got it spot on. So improving access to contraception is really important, and the ability to obtain the pill through pharmacies and kind of online providers clearly has clear benefits, but earlier access does have to be matched with really robust assessment, clear information and reliable follow-up. When we have access without review or safety netting, we risk missing changes in health or some of these early warning signs that are just so important.
Dr. Nikita Kanani, thank you so much for coming on to talk to us about this, a really important subject that, as Aine's family said, needs to be discussed a lot more. Thank you, Nikita, and a big thank you to Aine's mum, Kerry, and her aunt, Dawn, for speaking to us here on the UK Tonight.